What's your chance of getting COVID-19 twice? Breakthrough infections and reinfections have been a headache when Delta and Omicron variants emerged. These cases came to be despite the vaccination rates even in rich nations. But for those who had COVID-19 before, what are the chances of reinfection? In Australia, many are not getting the third dose of COVID-19 vaccines. One possible reason is that they already had the disease. Contracting and recovering from COVID-19 could make someone confident that they would no longer need a vaccine or its booster shot. Since they have been exposed before, they might be convinced that their bodies have enough immunity to fight back subsequent infections. The challenge is that COVID reinfections can and do occur, said Professor John Skerritt, head of Australia's Therapeutic Goods Administration, as per news.com.au. For those confused, breakthrough infection and reinfection are two different things. Breakthrough refers to an infection after getting a vaccine. The virus or bacteria successfully breach the vaccine protection. However, it doesn't mean the person will have the same expected risk as with someone unvaccinated. Their odds of hospitalization are significantly lower. Meanwhile, reinfection refers to getting infected again by the same germ, despite recovery. According to the US CDC, most people who recover from COVID-19 will develop some level of protection. But reinfections do happen, and ongoing studies are trying to understand how it happens. Speaking of studies, one published in the journal Nature showed the number of people reinfected with COVID-19 during the emergence of Omicron. This study analyzed the data collected by the UK Health Security Agency. More than 650,000 people were estimated to have been infected twice, with most happening in the preceding 2 months. Plus, cases of possible reinfection were estimated to have taken place at least 3 months after the initial infection. Just from that study, it sounded like reinfection could occur within 2 to 3 months after the initial attack. Why is that? One theory links the Omicron variant as the culprit. A separate study published in the New England Journal of Medicine showed how previous infections fared against different COVID variants. Versus Alpha, Beta, and Delta variants, a previous infection was around 90% effective against infection caused by these variants. Versus Delta, the effectiveness of protection was only 56%. But if every known factor is accounted for, the possible chance of reinfection is likely a year after the initial case. Very careful people may likely be cutting down the chance further with social distancing, face masks, and proper hygiene. People who are very careful and have been vaccinated, including with a booster shot, may have the lowest risk of reinfection. What do you think experts should look into these reinfection cases? Have you known someone who got infected more than once by COVID-19? Share your thoughts in the comment section. Till our next video, thanks for watching.